Dr. Nabarro has extensive experience not only from the WHO but also from the UN. But currently he's working with the WHO as their special envoy for COVID-19. And his role is to provide strategic advice and high-level political advocacy in different parts of the world today. Welcome, Dr. Nabarro, and thank you so much for taking the time to come and see us today.
Happy to be with you all. Thank you.
I'm ready to, of course, ask you a few questions. So,
Okay.
I wonder, we all appreciate so much the timely effort you are doing together with the WHO in fighting this pandemic globally. So how do you see the situation today? Are we heading towards the end of the pandemic this year?
Thanks very much. Actually, I've got really good news and not good news. I'll start with the not good news. This pandemic is ferocious, advancing nowhere near its end. Last week, we had the highest numbers of cases ever reported. And the situation in South Asia is a ferocious surge of the virus in India, in Bangladesh, in Nepal, and in Pakistan. Also in Latin America, there are some countries very badly affected. And the summary I'd like to say is that the virus continues to appear with localized spikes of disease that then can surge into outbreaks and swirl into explosive overloads of health services with people who are really ill. And that's often associated with the discovery of what are called variants, because this virus is present in huge amounts in the world at the moment. And that means that variants emerge, and they emerge all the time. So in summary, it's a ferocious pandemic, still advancing, with new variants emerging, increasing levels of disease. And I cannot, I'm afraid, in any comfort say to you, it's nearly ended. I don't know whether we're halfway through or a quarter of the way through. And part of me suspects this virus is going to stay as an unwanted new guest in humanity's existence, and that really we're going to have to work out how to keep it back and hold it at bay for the foreseeable future.
So we still haven't been able to catch up with it and sustain, the amount of variants we have. So we can see now that the richer, more, the developed countries of the world are putting their monies on vaccines and taking care of their inhabitants, while the less rich nations in the world and the less developed countries are struggling with getting their herd immunity with vaccines. Do you think this is the right way to go about, that the richer countries are taking care of themselves before they take care of others?
Well, I can understand it. You see, if you're an elected politician, say a prime minister of a country that has a high level of wealth, then it is natural that you will see your responsibility as looking after your people. And there are two roles that vaccines play. One is that they protect people who are at risk from dying. That's people in older age groups like myself. And secondly, if you get a really widespread distribution of the vaccine in a population, that will lead to a reduction in the number of people who can be infected, and that will lead to an overall decline in the pandemic. Vaccines should be used at the moment to protect people from death. We just don't have enough vaccine in the world to try to create population immunity. A few countries are taking advantage of their economic and other situations to try to go for population immunity within their own borders. That's great, but it has two side effects. One is that it uses up all the world's vaccine. And really, if we were doing it in terms of need, we would vaccinate the people who are most at risk, and we would view it as a global challenge, and we would go for health workers throughout the world and people who are susceptible. Secondly, I think that we really do need to understand that just widespread vaccination at the moment doesn't buy you security, because sooner or later mutants will appear that will completely evade the protection of the vaccines, and then we'll be back at square one. So overall, there's only one way to deal with this pandemic, and that is to respond to it as a global challenge. And there's only one way to deal with a global challenge, and that is for nations to put working for the world at a higher priority than working for their own citizens. In the end, it's better for your citizens if you work for the world, because none of us are safe until we are all safe.
So, I mean, we just heard Paul Pullman and Gary Hamel talk about how important it is for businesses to take responsibility as well, to address the world challenges. And how can businesses contribute in this crisis? Can they contribute at all?
Well, yes, actually they can. The first thing is a business needs to be clear to a national government that short-term political type results is not what they want. They want long-term security, security of supplies, security of being able to move, security of being able to ensure that they get their employees coming to work. And it is absolutely essential that business leaders everywhere are very clear on what they need from governments. Short-termism for the sake of political popularity is not what business leaders are interested in. Secondly, business leaders need to be part of the response. And that means that you're not just working for your own employees as well as your customers, you're also working for the societies in which you are. So you are, in fact, the ultimate good citizens. Thirdly, in the end, because private business is absolutely key to everything we do in our world, without business, we won't be able to do this response. So to business leaders, I say, please be there. Please be part of the solution, and please be very clear with political leaders in the countries where you work what matters to you for the continuation of your business. And by the way, in brackets at the end, I think we have to recognize that business may have to pay for this. It's not going to come free of charge. And business leaders will say, well, we're already paying. But I'm saying just pay the full cost. Pay what it costs for your employees to isolate at home when they're asked to isolate. Don't ask them to take a pay cut to isolate. All that sort of stuff. Good employer practice really matters, and it won't be cheap.
Well, that's not an uplifting message, but I guess it's the true message.
Yeah.
And it's the truth we are seeking. That is the context we are making business today. Very important to understand. So thank you very much for joining us, Dr. Nabarro. We really appreciate you taking your time out of your very busy schedule. Thank you very much.
Absolutely beautiful. Thank you. Bye-bye.
Thank you.